Women's Health Connecticut is the largest OBGYN physician practice in the region and solely focused on women.
I thought it would be helpful to talk about this period that we don't really hear much about called perimenopause. And this includes many years before you become menopausal with lots of a variety of symptoms that women often feel and don't know how to define. And we really want to give these women a voice and feeling like their symptoms are validated.
So let's start with, what is perimenopause and when does it occur?
Menopause, arbitrarily in the books, is defined as the period of time after a woman has not seen blood for a year. So you can imagine that the time coming up to that is very vague and can be protracted, can be short. It can include a period of time where your cycles are skipping and you have lots of symptoms during that time, or even when your cycles are just more irregular, which includes cycles closer together or spaced apart. And the most important thing is that it includes a whole variety of this. So the key to this period is variability, which can be scary and concerning, but can be managed.
What are some of the symptoms of perimenopause that women should be aware of?
So if the average age of menopause in this country is somewhere around 51 to 54, and again, it depends on your ethnicity and your family history and your mother's history, then you can imagine that perimenopause may start as early as your early 40s. It may continue until mid-50s, depending on when you are menopausal.
What causes perimenopause and its symptoms?
And this is why it's so important that we address this, because the symptoms can be very confusing. If you're talking about women who are still getting regular or slightly irregular cycles, these symptoms can look just like PMS, but PMS that is just out of control. So women will come and say, I don't know what's happening to me, my cycles are still regular, but for 2 weeks before my period, I'm having hot flashes and I'm having terrible sleep and my mood is unstable and I'm feeling prickly and just not myself. That actually is probably part of perimenopause. Whereas if you have a woman who comes in and says, oh my God, I have not had a period for 3 to 4 months, I'm having horrible hot flashes, but then I started to have regular periods and it's better, what do I do?
What is most important for women to know at this stage of life?
First of all, it is a normal rite of passage. The ovaries have a limited lifespan, and in our younger years, they create, fertility and normal regular periods. As they get older, they are starting to say goodbye, but not in a simple, easy way necessarily. However, women need to know that the symptoms that result of this slow decline in ovarian reserve are normal. They are annoying, but they absolutely can be managed.
So how do you help women alleviate these symptoms at Women's Health Connecticut?
As we alluded to, some of these symptoms are very specific depending on whether they're skipping periods altogether or just having irregular or just having that period which mimics PMS but is much worse. So for those kinds of symptoms, we can deal with issues around breast tenderness using certain vitamin supplements. We encourage exercise, really helps all those symptoms. Watching your alcohol and your caffeine. And honestly, eating a more plant-based diet is very helpful. Women are very concerned about the weight gain that seems to be part of perimenopause and menopause. It really causes tremendous agitation for many women, and we can really help them with that.
I can imagine that perimenopause is difficult for women to be aware of and when to know when they need to see their OBGYN.
Well, first and foremost, keep your appointment, because we here really ask about these kinds of questions. We don't just simply do the exam. We talk to them about all sorts of symptoms that women may not think are related to their gynecologic reproductive health. And so we will let them understand that what they're going through is real, and they feel validated and they feel supported.
Women's Health Connecticut provides comprehensive OBGYN care and compassionate support as you navigate through each stage of your life.